Senator Sanders urges Health Secretary Kennedy to step down amidst public health crisis. August 30th to 31st, 2025, U.S. Senator Bernie Sanders, a prominent member of the Senate Health, Education, Labor, and Pensions (HELP) Committee, has issued a public call for the resignation of Health and Human Services (HHS) Secretary Robert F. Kennedy Jr. in a critical op-ed featured in the New York Times on August 30th, 2025. Emerging controversy at the CDC. The demand for Kennedy's resignation arises following significant internal discord at the Centers for Disease Control and Prevention, CDC. Kennedy terminated CDC Director Susan Menares less than a month after her appointment due to her opposition to his proposed restrictions on vaccine access, restrictions she deemed inconsistent with scientific evidence. In response, 4 senior officials at the CDC resigned, and hundreds of others left the CDC headquarters in Atlanta in protest. Sanders' position: a risk to public health. Sanders criticized Kennedy's leadership as a danger to the health of the nation, charging him with disseminating vaccine misinformation and undermining scientifically supported public health initiatives. He stated unequivocally, "Robert F. Kennedy Jr., the Secretary of Health and Human Services, is endangering the health of the American people now and into the future. He must resign." He emphasized that Kennedy's actions, including reducing the availability of COVID-19 vaccines and creating bureaucratic obstacles, are already complicating and increasing costs for Americans in need of vital vaccinations. Sanders cautioned that the next target might be childhood immunization schedules, raising the risk of a resurgence of diseases such as measles and polio. Growing bipartisan alarm. Sanders' critique mirrors a wider wave of concern. Over 750 current and former health officials have labeled Kennedy an existential threat to public health. Demetra Daskalakis, the former CDC immunizations director, also expressed worries that Kennedy's leadership is undermining science-based policy and weakening institutional integrity.